All right, hopefully you have your thinking cap on, and we're going to move from the top part of the appendicular skeleton to the lower part, including the pelvic girdle, hips, and the legs and feet. So let's see what we can see here. We'll start with the pelvic girdle, the two pelvic bones. Now, you can see these nice big pelvic bones here, joined to posterior by the sacrum. Now first we want to see the three parts of the pelvic bone. We have this fanned out area here called the ilium. We have the anterior superior part. Actually, it's the anterior inferior part of the pelvis. The pubis area. And then we have the posterior inferior part of the pelvis, the ischium that you sit on back there. So as far as the landmarks for this, we have the iliac crest that you can feel on your own hip. And here is the anterior superior iliac spine right here. You can feel that yourself. Iliac fossa here dips in. And let's see what else we have on the ilium. Do we have anything else on the ilium? The greater sciatic notch and the auricular surface. The auricular surface you can see better on a separate pelvic bone. It's supposed to be shaped like an ear, and it's where the sacrum joins the pelvic bone. It looks more like an ear if we take the sacrum off. So I'll show you that on the separate bones. Sciatic notch is right here. The big sciatic nerve exits there. Move down to the pubis region, and we have the pubic crest here, and we have the pubic symphysis that joins the two pelvic bones in the anterior. That's cartilage, just like the intervertebral disc are cartilage, just like the costal part of the ribs where they join the sternum is cartilage. The ischium part of the pelvic bone, posterior part of the inferior part, there we can see several things there, landmarks. The ischial spine, low protrusion. The ischial ramus, just like we had the ramus of the mandible, vertical. And ischial tuberosity that we're sitting on right now if you're sitting. I'll move to the back so you can see them. Okay, now here you can see the auricular part a little bit better, where the sacrum joins. We also have a posterior superior iliac spine there. You can feel that as a landmark in the back as well. So you can feel both these landmarks, posterior superior iliac spine, anterior superior iliac spine, and the iliac crest. Here's my ischial spine here, ischial ramus, and this is the ischial tuberosity right here. Now we have to cover the acetabulum because that's where the big ball part of the femur is going to fit into the pelvic bone and really be able to roll all around and move our leg in all kind of different directions. It's a ball of the femur and socket of the hip, ball and socket joint, acetabulum. As we move around here, we'll also see the obturator foramen in the pelvic bone for large blood vessels and nerves and muscles. And then lastly, for landmarks or parts, we have the pelvic brim. And that's the edge or rim of the pelvic opening. Remember we had the abdominopelvic cavity? The abdominal cavity where digestive organs was here, and it connected to the pelvic cavity where my hand is. We called it the abdominopelvic cavity. So your reproductive organs and your bladder sit in this pelvic cavity. We had true pelvis and false pelvis. The true pelvis is inferior to the brim, pelvic brim, and it's completely surrounded by bone. Pubis part, ischial part, sacrum in the back. And then I could put my hand down in there. And then the false pelvis would be superior to the pelvic brim, this way, still surrounded by the iliums, the sides, but not in the anterior and posterior. There's nothing. Well, I'll say the posterior has the vertebrae, but in the anterior, there's not much. False pelvis, true pelvis. Now let's get to the femur. Let's back up a little bit. Okay. Femur, of course, has the head, a lot bigger than the head of the humerus. Smooth again because of cartilage. We have the neck. And then we have this protrusion here on the lateral called the greater trochanter. You know what connects there? Muscles. That's why it's thicker. That's why it sticks out. We didn't cover this. This is the lesser trochanter. We just covered the greater trochanter. All right, coming down, we have the shaft. Now we get down to the distal part of the femur, and we'll see several things. There's the patella kneecap. But notice down here we have two big expansions or protrusions. They're condyles. Condyles. And the medial condyle looks bigger, doesn't it? Again, the medial is usually bigger. And lateral condyle. These little parts on superior to the condyle could be called epicondyles also. We're going to have a nice articulation with the tibia here. So we're going to have some smooth cartilage there and there on the tibia. If I could turn this patella over, it would be smooth on the back. And because the patella is there, I can't see the patellar fossa under there. That's also smooth. Let's see what else we have on the femur. A couple things in the back we're going to look at. So let's go back there. Okay. So from the back, head, neck, greater trochanter. Now here, we have a gluteal tuberosity right here. And that's because the gluteal muscle is going to connect there. The big gluteus maximus is going to cover this back part of the pelvis and then come down here and attach to the femur. Be able to move that femur all around. Coming down from the gluteal tuberosity, we have this sharp line. That's the linea aspera, linea for line. And we have our hamstrings and some other muscles attached there. From the back, we can see the condyles nicely. you can see how smooth they are there. Medial epicondyle and the medial condyle a lot bigger than the lateral. So there's several ways to tell the posterior of the fibula, the femur, especially these big condyles from the back and this indentation. On the anterior, you will be able to tell the anterior because under this patella, let me see if I can lift this up so you can see it. Yeah, so there you can see there's a big smooth area under the patella. That's the patellar surface. That's how you tell anterior. Of course, the medial you can tell because of the balls medial and the big medial condyle. Let's move down to the tibia fibula. Tibia is going to be medial and the fibula will be lateral. Remember I said the way to remember that is fibula has a LA in it. Lateral. L for lateral, LA for lateral. Now notice the tibia connects with the femur, but the fibula does not. Fibula connects with the tibia on the lateral side. Fibula is really a stabilizing bone more than a movement bone, although there is some muscles connected to the fibula. So the parts of the tibia, we have condyles here too that stick out. Of course, they're smooth on the top where the condyles of the femur fit into them. Medial still bigger. Here's a good landmark. Tibial tuberosity. A lot of muscles attached there, including the big hamstrings on the upper thigh, anterior of the upper thigh, come down and connect on the tibial tuberosity. When that contracts, it would pull this and make you kick. Whereas your hamstrings, when they contract, they're going to pull your leg back, lower leg back. Patella here, and there'd be a patellar tendon here from the big quad. And when the doctor taps here to hit that tendon, patellar tendon, from the quad, that contracts and pulls this muscle, and pulls this tibia again, and makes you kick out. The other part of the anterior that's significant is the anterior ridge here, anterior crest, they call it. That's the shin, and you can feel how sharp your shin is there. The anterior crest. And feel this tibial tuberosity while you're at it. Feel your kneecap go down from there, and you can feel this tibial tuberosity. Follow it on down the anterior crest. And then you get to the ankle area. And here you're going to have a couple protrusions. This is called the medial malleolus here. And that's a lot bigger. Again, third or fourth time that the medial side's been bigger. A lot bigger than the lateral malleolus. Now the lateral malleolus is actually the distal end of the fibula. Now these two malleoluses you can feel as part of your ankle. So feel down your ankle now and feel on the medial part, you can feel this sticking way out. That's the medial malleolus of the tibia. Now feel the lateral part on your own ankle. Doesn't stick out quite as much. That's the tip end of the fibula. And they're going to surround this major foot bone we're going to have here called the talus. The other part of the fibula to know, there's the medial malleolus. I think my Camera got moved as I was talking and pointing. Medial malleolus of the tibia, lateral malleolus of the fibula. The other part of the fibula to know is the head. So for the fibula, only you need to know head, shaft, and lateral malleolus. And that the fibula articulates with the tibia here, not the femur. So there's going to be a smooth area here on the head of the fibula. And on the underside of the tibia right there. Fibula also has a sharp crest on the anterior. All right, so if you're trying to tell the anterior of the tibia, look for the tibial tuberosity, look for the anterior crest. If you're trying to find the medial, look for the medial malleolus. If you're trying to find the superior, you look for the big condyles. All right, let's get to the foot and ankle. Now here, we have two really big bones in the foot. These are the tarsals that make up your ankle. From the front, the foot bone, the tarsal bone, that goes up between the malleoluses, that's called the talus. Under that, we're going to see the big calcaneus heel bone here that we walk on. Now, let's go over here. Let's change position. All right, from the side, you can see better the calcaneus particularly. And remember your calf muscle, the gastrocnemius, is going to come down behind the tibia, posterior to the tibia, and have a long tendon connecting to the calcaneus bone, the Achilles tendon. And if that were to contract, you would pull this heel up, be walking like that, pull it up, and you can see you extend your foot. The other bones of the foot, these are all tarsal bones. So we had the talus and the calcaneus. We have some other tarsal bones here. 5 more besides talus, calcaneus, making 7. Then we get into the same kind of scenario we had with the phalanges of the fingers. We just get a side view of this foot here. Calcaneus, talus, the other tarsals. Now we're going to get metatarsals and phalanges. Back to the front. Making a lot of noise here on it. Well, if I know these are the tarsals, I know these are the metatarsals, making up the ball of the foot. And again, if I want to count back, I can count the 3 phalanges. 1, 2, 3, and then I have the metatarsal. Remember, the big toe only has 2 phalanges. 1, 2, and then the metatarsal. And it's the same. We have a distal phalanges, middle phalanges, and a proximal phalanges, and then the metatarsal. When we get to joints, I talk about this foot joint, how this is a pretty stable joint here. Vorticen tendon joint, it's called, because we have the center part of the talus surrounded, going up into the space surrounded by the 2 malleoluses. Knee joint is more like a hinge joint, where we can flex our lower leg and extend Not much rotation allowed there. But the big movement is with that ball and socket joint, femur hip, where you can do all kinds of motions with our leg, and we can roll it around. We can circumduct our leg, adduct, abduct, move it out, adduct in. We already said flex, extend. A little bit of rotation. All right, I think he took his hand off his head. He's had enough. Okay, so that's it for the lower part of the appendicular skeleton.